Hello, hello, and welcome back to Me Time. This is part two of the video. So check out part one. Part one is really about my own nursing experience and my journey and how I decided I was ready to go back and get my master's. This part of the video is part two, and I'm going to be discussing specifically about things I wish I thought about before I accepted a program and before I went back to grad school, and some questions that you should be thinking about if you're thinking about obtaining your master's in science of nursing or going back to become a nurse practitioner. I first thing I would say is important to consider is timing. And you have to consider timing for you. Is it the right time for you to go back to school? Do you feel like you've had enough RN experience to do that? Do you feel like you're ready to take the next step? Is the next step with obtaining your NP license going to be towards your overall goal in your nursing career and your field as a nurse? I would also consider, do you have time right now to go back part time, or can you go back full time? What does that mean financially for you? Are you going to work? How much can you work? Do you need to drop down to part time or per diem in order to make that happen? But also consider, do you have to move? There's so many moving parts to going back to grad school that you should consider. And obviously, you have to make the decision so it's right for you and your family. I would also encourage nurses not to feel stressed or pushed to go back to NP school. You have a long time to do that. You don't have to go back right away. I would actually encourage you to get some RN experience beforehand so you can really figure out what you want to do as a nurse practitioner. If you just want to, especially if you're going to think about going into a specialty, you might want to take a position more in that specialty so you can think, do I really want to do this? Especially if you're going to go towards a more specialized NP licensing certification, which we'll get into in a second, because that can make a difference a couple of years down the line if you're 5 or 6 years into becoming a nurse practitioner and you want to go back and obtain a more broader scope, which is totally possible. They have postmaster certifications for a reason. So for timing, consider where you are in your career. Is it the right time for you to go back? Are you ready to go back? How long will it take you to complete the program? And also think about maybe going full-time versus part-time. A lot of people go part-time, and sometimes I think going full-time is if you can make it, is definitely a great option as well. I would also consider, for individuals or folks thinking about going into the nursing field that are not nurses right now, having a second career, find a program that's right for you. If you think you want to go straight into becoming a nurse practitioner, and that's really at the end of the day what you want to do, and you don't think you want to spend time being an RN for quite some time, I would say go into a direct entry program that does BSN straight to MSN. In particular, my cohort in my program that I did at my school, most of my cohort was doing the direct entry, and they were rock stars and superstars, and I really commend them. It's very difficult, but I think that that's a great way to kind of push yourself all the way through to where you want yourself to be at the end of the day, at the end goal, especially if it's your second career and you're ready to make that next step. So there's lots of options. Consider timing. The field of nursing is very flexible. So make sure you're just spending time thinking about that so you're not rushing into anything. So number two is specialty and program. So there are so many specialties out there, and especially now. I feel like when I applied a couple years ago, I don't remember. I mean, there was definitely lots of specialties, but I didn't get exposure to many of them. I feel like the most popular form of being a nurse practitioner was a family nurse practitioner or CRNAs or acute care. In my experience as a nurse, I saw in the hospital was mainly PAs, obviously internists, and then just towards the tail end of my program, I was seeing more acute care NPs graduate, and that was really neat to see that. I think you have to really focus on where you want to be in your career. You have to take into consideration where you might be working, also the geographic location that you're living and working in. If you are in an inner city or a city or a very well-populated area that there's lots of job opportunities as a nurse practitioner, I would say go for whatever specialty you really are interested and passionate about. On the other hand, if you're in a more rural location, I would encourage you to get a broader scope certification just so you're going to have more flexibility and possibilities when it comes to obtaining a job. Even if for example, say you live somewhere where there's not many clinics and the clinic that is there wants you to see pediatrics, you have to consider that as an option. So even though you aren't really interested in doing just peds, they want you to have that full scope of having an FNP, family nurse practitioner, and vice versa. Maybe you've always worked with pediatrics and that's the type of patient population you really enjoy. Maybe you see yourself as working in a peds office, but you are living in a state and going to be working in an area that's more rural. Maybe it is actually better for you to obtain your family nurse practitioner just so you have the full scope versus just going into peds. Now, I don't necessarily think it's 100% necessary to get an FMP license. I think I did not. I did adult gerontology, primary care, and women's health. So adult gerontology primary care is age 13 years and older. I have run into a few instances during job interviews where it wasn't necessarily a problem that I couldn't see or I wasn't licensed to see pediatrics, but I think it could have been more beneficial if I had that part of my licensure, just so that they could say, yep, you can see kids, even though we don't see a lot of kids. If kids come in, you're able and licensed to see them. Or if you want to work in a school-based setting, this is something I didn't really think about that much, where even if it's more adolescents, like at a university, or if you're working for a school system, they're going to want you to have your full scope of practice, so more of like a family nurse practitioner role. So take that into consideration. I also think that people should consider dual programs. I did a dual program, and in hindsight, I'm really happy I did a dual program. The reason why I did a dual program is because I was interested in women's health, but I wasn't certain I really wanted to go straight into women's health alone. I didn't know how much I was going to enjoy that field. So I wanted to have a broad spectrum so I was able to get a job in women's health if I had wanted it. Now, you do not need to have a women's health certification to get a job in women's health. As we all know, you can be an FNP or adult gero NP and still get a job in a women's health setting. However, I definitely think it helps your application. I think it just prepares you overall as a nurse practitioner. You feel more confident probably in your skills because FNPs don't always get many hours in that training. So it can only be helpful for you as an individual NP, so you have that knowledge base and or procedural skills to move forward. And it all kind of depends on your clinical practice, of course, during your rotations. But sometimes I think that if you're unsure or you are interested in a specialty, maybe doing a dual program at the beginning so you have a broader scope is actually better in the long run, maybe 5 years out or even 7 years or 10 years. Now, there are postmaster certifications, so do not feel stressed if you don't do a dual program or if you're unsure if you want to do a dual program. I know many individuals and NPs that have gone back to get their postmasters once they realize, like, hey, I think I'm ready for a change, or I want a different focus, or I want to know more information about this field. I don't feel like as well trained, and I feel like I actually want to go through a whole postmaster certification. So that is an option as well. So what I'm trying to say is understand what you need, what you want, what's going to be best for your geographic location, what's going to be best so that you can find a job in a area that, that's going to pay off for you in the long run. And also think about longevity, not just specialization. Specialization is great, but sometimes it's better to be broad and specialize afterwards. So take that into consideration when you're thinking about which programs and specialties to go for. So number 3, I want to talk about programs. And does your program matter? And that is definitely a loaded question. Does your MSN program matter? I think yes. And it matters in a few ways, not in the, I might surprise some people by saying yes for the context that I'm describing. So I think it matters because I want you to know the time commitment. So it matters on what works for you. So overall, the program matters for you if they advocate for you, if they support you, if it's best for your personal needs. So even if it's the number one program, or it's not the number one program, and they support you, they help you find clinical, they do all the things that you need, or they have good preceptors that you want to work with, that's what you should focus on, not always the name of the university. Obviously, the university name can help sometimes, but I think what really matters is the nitty-gritty about the program, and that's what you should be focusing on. So one, I would understand if your program is, are you going to do it locally? Or are you going to be a distant student? If you're doing a program locally, likely what that means is you live in the same state and city that your university is in, so that you can have ease of access of going to campus when you need to go to campus, or it's close by enough that you can get to campus for skills checkoffs. How often does your program need you to be there on campus? Every program is totally different. My program, I had to be at my university 1 week every month. And so that means that I had to have an extra week off, that I was not able to work that week. I had to find a place to stay. That can be a financial burden as well. And then you're interrupting you get a great experience. I really enjoyed that about my program, but it did add on an additional layer of stress. And that's because I was doing a distance program predominantly. So take into consideration which program is best for you if you're going to do a distance or local program. That ties into finding clinical rotations. So usually part of MP training, of course, is your clinical rotations. The biggest thing you need to ask your programs is, do you help students find a clinical rotation? If they say yes, what does that mean? Does it mean that they're going to give you an Excel spreadsheet of a couple names on it of students who did location clinical practice in that area? Do they have a list of people that have already agreed in the past to take on students? Do they have a particular preceptor in mind for you already? Or is it that they will help you find a rotation and assign you a rotation so you can't choose? And what does that look like? Does that mean you have a 2-hour radius? What mile radius does that mean? Because sometimes that can be very far away from where you live, but you still need to take time off of work to live in that area so you can complete the clinical rotation. So even if you're a local student, you might still have to travel quite a bit to get your rotations completed. So that's why it's so important to know the ins and outs and specifics of how they're going to give you clinical rotation if your school is agreeing to do that. If they are not agreeing to give you clinical rotation, you need to ask, what does it mean if I cannot get clinical sites? Are you going to help me find a clinical site if I cannot find one? What does that look like? What is the timeline? What are the steps that I have to go through if I'm not being successful in finding a site? Is there any legal implications to that as well? I would also ask, what does that mean if you can't find a site? Does that push you back a semester? Does that push you back a whole year? Depends if you're doing a part-time or a full-time program. This has happened to some of my friends where they were unable to secure a clinical rotation, or they had one and the preceptor fell through at the last minute, but that class was only offered at a very particular time in the year. And if it's only a part-time program, that can set you back sometimes a whole year in the worst case. So I would ask all these questions up front so you know what to expect if that ever were to happen. I hope it never happens to you, but it happens all the time. And you need to know what that means for you as a student, because that also carries financial implications as well. Okay, so do they help you find a clinical rotation? That is like the biggest thing you need to ask. You need to know the ins and outs of that. You need to know the distances that, if they do provide clinical, what that means, what distance they're going to offer you. And you have to also be okay and be in a flexible position where you can make that happen. So I think that's probably the most important thing to ask, which I did not ask. I would also think about what does it mean when I would ask, if you're a distance student, understand what it's like to find clinical in that area if you don't have connections, or if you don't have a particular person you're going to do your clinical rotations with identified already. The reason why I say that is because if you live in a educationally rich area, where you live in a state or a city that has many local NP schools, that has medical schools, that has PA schools, that has nursing schools, oftentimes in that area, those students that are going to the local university are going to get spots at these clinical practicum sites first. So even if you find a preceptor, the preceptor likes you, you like them, you want to work with them, but you don't have a site, but you go to a school that's outside the state, and even if you live there, you have to have a legal contract and agreement with that organization. So some organizations just say, no, we're not going to create a new legal contract with your university. We already have contracts with all these local universities. We want to focus on these areas. We want to focus on these local universities. And there's also a whole line of students that need those spots. So that could be that can definitely happen. That happened to me. I was living in Massachusetts at the time, and I was trying to find preceptorship, and I did not go to a local school. I went to a school that was further away. And that was a problem that I ran into quite a bit. So I wasn't really expecting that. I also really didn't understand that because I figured like I have connections. I can definitely find a clinical practicum site. I don't think it should be that hard. It was really hard. It was probably the most stressful part of my whole program. And I actually had to move 3 different times to complete my clinical rotations. And I'm talking about 3 different times all over the United States. So I also did clinical during COVID, which definitely was very unique and probably unique to it wasn't just unique to me. I know other students that were struggling with this as well, but it was particular based on whatever state you lived in at the time too. But understanding that can really put into perspective what it might be like for you to find a clinical rotation. So I would ask your university that too, like, hey, has any former students recently gone through this? Can I even reach out to them and kind of ask them firsthand what their experience was like? Can I maybe talk to that preceptor already now to see if they're going to be willing to precept me before the program starts? So these are things to think about and to ask about as well. So at the end of the day, like I also want to talk about clinical training because clinical training can make or break your experience as a nurse practitioner. And also you have to think in the sense that clinical training is really preparing you for the workforce. So it's preparing you to come out of school and to be able to see your patient panel and for your skills to be like at the very top of your level. Obviously, you go through a growing process. You could do a post-master's residency program. You might have a job that really invests in new grads, that likes to train new grads and gives you some extra time to kind of get used to the role as a nurse practitioner. And then some positions, they just throw you right in and here's your patient panel on day one. So the more you can take advantage of your clinical rotations, making them the best experience for you, it is definitely the best option. So you want to have a clinical rotation that offers you clinical skills, that you get to do procedures that maybe some of the other students never get a chance to do. If you can allow yourself to really understand the full picture. What I mean by that is a lot of times as students, we do our assessment, we do our diagnosis, maybe you're prescribing medications, you do your procedure, but you don't always get to do that follow-up management. So you get your labs back, you have to determine what to do next. You don't always get the chance to have that follow up with that patient. You don't always get the chance to really understand what it means to manage everything. And sometimes that's not possible because it's all going to your preceptor's inbox, to their local computer system. But that's something that I wish I got more opportunities to do, or I had more opportunities to go through more imaging results so I could talk to my patients about that. So those are some things that once I became a nurse practitioner that you have to learn on how to figure out and manage, that you don't always get the opportunity to do that when you're a student as much. So I would focus on finding a preceptor that's going to allow you to really grow as a nurse practitioner and to prepare yourself for practice. So keep that in mind. I know you don't always have control over that, but if you can find a preceptor that really wants to invest in you, I would highly recommend doing that and, really getting the most out of your clinical experience, because clinical does matter. So those are my tidbits for applying back to school, things you should be thinking about. Things I wish I did. I wish I definitely applied to more than one school just so I had more opportunities to compare programs. I wish I questioned the clinical practicum a little bit more. I wish I had a personal, better understanding of it. I feel like I wasn't prepared for what I did have to do. I wasn't prepared to have to move as many times as I did. I'm very thankful that I was able to do that. I was very flexible at that time, but if I wasn't flexible, I definitely wouldn't have graduated on time and I would have been behind on my program. So anyways, these are some things I'd like you to think about and to consider. I hope you like and subscribe. Please feel free to leave a comment and tell me maybe about your experience in your master's program or your postmaster's program. If you want to leave a topic that you think you would like to hear about in the future, also leave a comment as well. And again, thanks for tuning in to this episode of To Me Time. See you next time.